shift a little bit from research into KT or knowledge translation. But I think this talk dovetails really nicely from all of the work from the previous panelists, starting with some of Julia's work related to how older adults use cannabis, when, timings. So Jason's descriptions of polypharmacy, co-occurring conditions, and then some of Simone's really good points about knowledge that physicians do or do not know about cannabis, and researchers kind of being in a bubble as well is a very important point. So I'm going to present a knowledge translation or KT initiative from the Michael J. DeGroote CMCR or Centre for Medicinal Cannabis Research. Do I want to change the color scheme? No, it's a little late for that. So if you have a phone and you want to look at some of the materials, this is a specific handout that we developed related to older adults and cannabis use. And so you guys are a particularly great audience as researchers to give us some feedback on this. And we're sort of at the stage now where we're refining the materials that we have developed. So feedback is incredibly key to the final product. So as I said, this is a knowledge translation initiative. And so we hope to get your feedback as well as present a little bit about the process and the content. And we've developed a series of bud talks that really work to be pro-evidence. So it's not based on opinions or on anecdotes, but really on the current state of evidence related to what we know about cannabis right now from the scientific literature. The work that we do is very much focused on being very approachable, very person-centered, non-stigmatizing as well. And it's reflective also, being chosen in Bud Talks, that knowledge is still sort of budding about cannabis. We know a little bit, but there's still a lot more that we really need to know and discover. We hope that, like TED Talks, Bud Talks are informative and engaging as well. And one of the really important things that we work at is making all of the content accessible to everyone. So the materials developed at a grade 6 level and also follows AODA standards. So the Accessibilities of Ontario Disabilities Act standards. So things related to like font, color, that everyone can very quickly, easily get some of the information. So before I do show you a little bit of the work that we've done, I just want to mention I am presenting today, but there is a whole village behind me. I work very closely with Deirdre Corney, who is a counselor at Alcohol, Drug, and Gambling Services in Hamilton. We've been working together since 2016. There's also an entire team of students and researchers, clinicians. We have a learning specialist as well, Jean-Pierre Joubert, who helps us with the design. We have animators too, so that it's definitely not just me involved. Just to briefly emphasize what KT is and the importance of knowledge translation. The average person really doesn't know the latest scientific findings and research, and there's this huge gap often between cannabis researchers and those people at the front lines, like clinicians, like the average person, like doctors often as well. So we know that cannabis research is continuing to evolve, and so we have to work as researchers very hard to bridge this gap between the research world and the front lines. And knowledge translation links this creation of knowledge from research into very real-world situations. And there are very specific interest groups, often with specific interests. In this case, I'm going to focus on older adults. So before we did develop the materials, we did do some surveys and talk to people in the community. I'm just focusing a little bit here on older adults, but we also talked to pharmacists, clinicians, healthcare providers as well. Many people don't know that older adults are actually the fastest growing age group of cannabis users currently in Canada. And we know that that many people use cannabis for specific health conditions like pain, like sleep, load issues. And these problems all tend to increase as we get older. And it's one of the main reasons why older adults are curious about cannabis. And at the same time, we have this decreasing perception of harms around cannabis, which is dangerous because older adults in particular have specific health conditions that we know can be affected by cannabis. The other unfortunate thing is that there is very little research done specifically in older adults as well. So the research is often very limited or based in a much younger age group. So as part of this KT process, we've really worked to engage with older audiences, with clinicians, pharmacists as well. So the content is developed to be specific to issues that older adults might face, including health risks, and particularly polypharmacy is a big issue in older adults. So finally, the point of this handout is also to guide people, encourage them to have a bud talk with their doctor. So to again take the stigma out and actually give people a list of questions in hand to go to their doctor with if they're interested in using cannabis. So these are the handouts here, or the first few pages of them, which maybe you have now as well on your phone. So we wanted to get some certain key messages out. One of them is that cannabis use can be dangerous. This is a study that this is an adaptation of findings from a study that just came out in Ontario in spring, looking at ER visits in older adults over the years that are related to cannabis poisonings. And you can see there's a steep rise that has occurred coinciding with different aspects of legalization in Canada. And so we wanted to draw this attention to older adults in the handouts. We also wanted to point out that the issues of potency, that this is not the cannabis of your youth. So I actually emailed El Soli at the NIDA potency monitoring program to get a little bit earlier data, possibly on THC potency. So that would coincide with the 60s and 70s when older adults may have been trying cannabis for the first time. And you can see rates, I know it's probably very small here, but rates about 1, 2, maybe 3% that really bear very little resemblance to the 16 and 20% that people often report nowadays. So this idea being that even if you tried cannabis in the past, especially the very long past, it doesn't necessarily prepare you for what is mostly being used nowadays. Keeps asking me if I want to change the color, and no, it's too late. Okay, and we wanted to also do a little bit of psychoeducation as well in terms of the language around strains, cannabinoids, unregulated naming as well. So steering people away from this sativa, indica, basically telling people that there's a lot of strain crossbreeding, that these distinctions aren't really meaningful. Instead, pointing people to cannabinoid interactions and giving the analogy of a soup, of an alphabet soup, and that cannabinoids can interact in different ways that we often don't know about either. And then the issue of unregulated naming is huge. You can say that banana slapdog is your favorite product, but it could be a completely different product at different dispensaries. There is absolutely no relationship between the name and the content as well. And these are things that many people will not know. So we want to highlight those things. We also know, as some of the other panelists have talked about today, that there are very specific health risks in older adults related to movement that can be exacerbated with cannabis use, to thinking as well. So memory problems, confusion, things like that. So pointing people to specific health risks that they may have and that they may experience intensify with cannabis use. We have a specific section that's really focused on medication interactions in older adults as well, because we know that many people are taking different products. We had lots of debates around or discussions around what names or should be at brands or specific things, but often people aren't even sure what they're using or the specific product. So we try to keep things more generic in the presentation, but then rather talk a little bit more about drug interactions. The idea is that medications can interact with cannabis and having additive effects, synergistic effects, or combined effects as well. We also had a special nod to alcohol. While that's not a medication per se, many people consume alcohol. Many people consume it together with cannabis as well, and just pointing to specific synergistic effects with when you drink alcohol. So we tried to explain drug interactions as well in terms of all of the possible types of effects that can occur. So lowered effectiveness if your medication can be cleared out of the system at a much faster rate or at a slower rate. The science on interactions with warfarin, unfortunately, the studies are not that high quality yet, but we decided to put this in nonetheless because there's enough case studies with extreme caution talking about bleeding out in patients that really warrants a warning at this point, even though it's probably a little bit preliminary still. We also wanted to pop the bubble on CBD a little bit and mention that it isn't risk-free. So there's a lot of hype and hope around cannabis, around CBD, that it's sort of the therapeutic aspect, that there's no side effects, that it can soften your hair, you can put it on ice cream, you can do almost anything with it if you look at some of the literature. But sort of talking about the fact that there are side effects from CBD related to often GI issues, often fatigue, confusion, things like that. So pointing out some of those and specific methods of intake too. So vaping versus tinctures that individuals often use. There's very little high quality research at this point, specifically looking at drug interactions, medication interactions with CBD, and almost none in older adults. But we do know that there are specific CBD interactions with specific enzymes that seem to cut across multiple medications and change the way that they do their job. So we try to highlight that as well in the handout. We also try and explain why it's so complicated with cannabis. So many plants that we know, like tobacco, poppy, the coca plant, they have one active component: cocaine, opiates, nicotine. But when we talk about cannabis, we're talking about such a myriad of cannabinoids that it's very difficult to get a clear reading on how all of these might interact, let alone all the other things that people have brought up, where it's grown, potential contaminants, things like that. So all of this is to guide people to have a bud talk with their doctor. So we had the initial idea of just having cards where people could keep them in their wallet, but then the information kept mushrooming and things we thought are significant to include. First, we had 2 or 3 questions, then we would argue about, no, this is more important, no, this is. So there's a ton of questions here. As I hear other people's presentations, I can think of more. But the idea is not to specifically focus on a drug, but rather to open up the discussion, because a lot of the knowledge, as we talked about, is still developing or is still unknown. So these are some of I'm just breaking down some of the sections, preparing first to have the bud talk, having some questions in mind already, thinking about the medications that someone is already taking, and then specifically saying what your goals are for using cannabis. There's often this mismatch. There's studies that show that there is a mismatch between what a patient often thinks the goal is and what the doctor does. So having the goals really explicitly stated. Also, if you have a history of cannabis use, that could be relevant as well. Then when you're actually talking with your doctor, there's a series of questions about your goals, about medication interactions, if you should change medications, if there might be other types of procedures or treatment that could be right for your condition. So opening up that discussion. So we have questions around that, and then sort of long-term views. What can you expect? So again, how often should you talk about your goals, revisit if it's working, if it's not working? How will it affect very basic aspects of your life? Like, can you drive after using cannabis? The other questions, I think I forgot to mention in the previous section, relate to dosage. And although often that's actually not well known or well studied, it nonetheless pushes it to the forefront and makes, I hope will also make doctors more on their toes. Like, is there a dosage recommendation? There can be for some things, but often there's not. So nonetheless, it brings up these discussions and this awareness. So, as I said, we're still collecting feedback, and we will refine the products based on the feedback. We're hoping to have this all incorporated on the CMCR website, the Michael G. DeGroote Centre for Medicinal Cannabis Research website, together with links to other resources, like links to the original studies as well, so that people can check those out if they want. We didn't include all the citations and references on the original handout because it gets far too messy. So yeah, we're also developing these into a sort of modular design in PowerPoint, so clinicians, educators can take what pieces that they like and they want to make sort of custom tailored Lego brick presentations that they know is evidence-based. And we're also hoping to promote this to pharmacies and other healthcare providers as well to make them as accessible as possible. So as I said, we do want your feedback. We have a series of questions as well on how engaging the material is, what you think of the visuals, et cetera. So I would love to hear some feedback from various audiences. And just being aware of time, thank you very much to all my team and collaborators and to the many institutions that support this work. Thanks very much.